In the second section of our lecture, now we will talk about some precursor lesion of the pancreatic cancer. Means what are some lesions that can lead to pancreatic cancer or carcinoma, how the patient with pancreatic cancer they present, what are the signs and physical signs and symptoms of the patient with the pancreatic cancer. So the precursor lesion of the pancreatic cancer, we have intraductal. Intraductal means inside the ducts. Mucinous papillary neoplasm. These intraductal mucinous papillary neoplasm can lead to the pancreatic cancer. They are more common in older persons and they have high malignant potential. Pancreatic cancer, they have a very high potential for malignancy. A lot of patients, when the pancreatic carcinoma is diagnosed, it already is metastasized or it's spread that it reached to the point of usually no return. So it's very fast spreading type of cancer. It's common in intraductal mucinous papillary neoplasm is common in older person and it has high malignant potential and it's a precursor lesion of the carcinoma of the pancreas. Then another precursor lesion is the mucinous cystic neoplasm. Here this picture shows the mucinous cystic neoplasm. In this the cyst is formed which contain the mucin and these cysts are the fluid filled sacs. So this is a picture of the mucinous cystic neoplasm. It's a solitary lesion, single lesion, and there is no communication with the duct system. As compared to intraductal, which is inside the duct, which has relationship with the duct, this is a solitary lesion, has no connection with the duct, and it's a mucinous cystic neoplasm. Exclusive female distribution. It's common in the female. Exclusively, it has female distribution. Clinical feature of the pancreatic cancer, very common obstructive jaundice, because there is as a result of the tumor or the pancreatic cancer, there is obstruction to the flow of the bile and this obstruction causes obstructive type of jaundice, which is the yellow discoloration of the skin caused by increased level of the bilirubin. So there is obstructive jaundice. You can see the yellowness of the eyes. There is abdominal discomfort and abdominal pain. Pruritus, itching is very common in jaundice and there is increased level of bilirubin. That pruritus and itching occurs in the obstructive jaundice. Jaundice. Then there is lethargy and weight loss. Patient is very lethargic, weak, have no energy, and there is weight loss. And epigastric pain. Epigastric pain is the pain in the upper middle quadrant of the abdomen, and this epigastric pain is present in patients who have pancreatic cancer. So there is obstructive type of jaundice, which is increased level of bilirubin, caused or characterized by yellow discoloration of the skin and the eyes. There is abdominal discomfort, there is itching, there is lethargy and weight loss and epigastric pain. Next also there is backache, new onset diabetes mellitus. Pancreas are damaged or there is pancreatic cancer. So diabetes mellitus, which is decreased production of insulin from the pancreas, it develops. There is also acute pancreatitis, nausea and vomiting, gastroduodenal obstruction. Duodenum is the C-shaped structure in which the pancreas is present, and there is gastroduodenal obstruction because of the presence of tumor in the pancreas that cause obstruction of the duodenum, and that also leads to nausea and vomiting because there is an obstruction to the passage of the food, and there is obstruction to the food on swallowing. So all these are the clinical features associated with pancreatic cancer. Physical signs. Physical, what the patient signs are the things what the you can see or observe. Symptoms are the complaints that the patient tells to the doctor. So signs are jaundice and cachexia. There is weakness and there is jaundice. Scratch marks are there because of the itching and pruritus as a result of the jaundice. There are scratch marks present. Palpable gallbladder. Gallbladder is palpable, that is known as the Courvoisier sign. Hepatomegaly, there is enlargement of the liver. Ascites is present, there is fluid in the abdomen. Left supraclavicular lymphadenopathy. This left supraclavicular lymphadenopathy is known as the Werkus node sign. So these are some physical signs of the patient. Hepatomegaly, enlargement of the liver. And in the cirrhosis and enlargement of the liver and cirrhosis and hepatocellular carcinoma also, this ascites is very common, which is presence of fluid in the abdominal cavity. And then periumbilical nodes are present. This is known as the Sister Mary Joseph's node. So all these are the physical signs present with the pancreatic cancer. So it's on physical examination, if there is pancreatic cancer present, it's not hard to diagnose even on physical examination. It is associated with jaundice, itching, and there is pruritus, but these are also the signs and symptoms with the hepatitis and the liver problems and biliary disorders, cholecystitis. So it's very important that the diagnosis should be done with the biopsy so we can start the treatment early on. So that concludes our section 2 of the lecture Pancreatic Cancer, in which we talked in detail about the physical signs and the symptoms associated with the pancreatic cancer, and the main features associated with pancreatic cancer are due to the jaundice, which is the increased level of bilirubin, and as a result of this jaundice, the patient will present with the yellowish discoloration of the skin and yellowish discoloration of the eyes, and the jaundice can also lead to the itching and pruritus, and when the patient constantly itch or as a result of pruritus, then there are itching marks on the body also, and then besides that there is ascites present, which is presence of fluid in the abdomen, and there is hepatomegaly, enlargement of the liver, because if you remember in the diagram we talked about that the liver, then we have gallbladder, biliary tree, and the pancreas are very, very closely related structures, and any abnormality or problem in one organ can lead to the abnormality of the other organ because of the flow of the bile through the biliary duct that is carry the bile from the liver, gallbladder through the duct into the pancreas, and through the pancreas it goes to the C-shaped duodenum through the ampulla of water. So these were all the signs and symptoms of the condition that is associated with the pancreatic cancer. Thank you for watching sqadia.com.